Hello, my name is Kushal. I work as a specialist neuro-occupational therapist in London. Today I'm going to talk about a subject that is very close to my heart, and that is occupational therapist raising toilet height. If you're an occupational therapist, or if you haven't come across an occupational therapist, you might be familiar with this, raising the toilet height. Because say this is the toilet. By the way, because I'm doing this video at home and for health and safety reasons, I cannot bring equipment from home. So I have to use alternative way of explaining the principles of talking about this. In particular, if you're an occupational therapy students, you must remember this, must hear this, must spread this message to your friends, must discuss in your class. Yeah, what I'm going to talk about, raising toilet height. So basically, if normally in UK at least, if an occupational therapist goes and sees that the patient cannot get up from the toilet, and obviously it is a false risk, normally we think about an equipment that will make the toilet higher, and it will make the standing up from the toilet easier. So let me just show you what are the three main types of equipment I'm talking about. The first one we are talking about is a raised toilet seat. Yeah, that basically is, if this is the toilet, that sits on the top of the toilet to make the toilet higher. Okay, that's number one. The other option we have is a toilet frame, a freestanding toilet frame that sits around, goes around the toilet and gives, basically it's like an armrest. It gives two arms from which people can push up. And the number three is the combination of both. This is a toilet frame with a raised toilet seat. So the raised toilet seat and freestanding toilet frame combined is this one. I call it Mowbray, but different people call different names. Okay, so now the question is that why I'm talking about this today. The problem is this: if we use the raised toilet seat or the Mowbray, please remember it can increase the false risk. Why? You're thinking. Now, when the toilet is low and when we try to stand up from any sitting position, we use our quad muscles and other hip muscles to push ourselves up. Now, if those muscles are weak, then we can raise the height. For example, equivalent to putting another something on top of that to make it higher, to raise it. Okay? Now there's a problem. There are two problems. Number one, in UK, the toilets are standard toilet size are 16 to 17 inch for a reason. Because when we are sitting low, it helps us to open the bowels. Because when we are sitting down, our back passage opens up. Yeah, and in this position the bladder also opens up, the bowel also opens up, and it helps the gravity to open our bowel. So if you are seeing somebody patient and you want to issue one of the Mowbray frames or whatever it is, or raised toilet seat, look at the medication chart of the patient. Is the patient on a laxative, or is the patient on any painkiller like codeine, which can cause constipation? In those cases, think carefully. By raising the toilet height, are you going to cause constipation? Number one. Number two is think about what is the long-term effect of not having that exercise of sit to stand from a low toilet. Because when we walk, one of the things is the step to gait. We step heel to toe. And which muscles helps? The hip flexors and the quads helps us to lift our feet up. And if the patient is losing the exercise of sit to stand, which strengthens those muscles, what is going to happen over the period of time? People won't be able to lift their leg. They will be shuffling their leg, and gradually the ground clearance between the foot and the floor will become less and less, and that increases the chance of scuffing and falling over. Think about this. A piece of equipment, very cheap, can have a long-term implications. So now the question is that out of those three, raised toilet seats, Mowbray, and freestanding toilet frame, which one is preferable? You have to think about safety, definitely. If somebody cannot manage, you have to give raised toilet seat, but please not only give raised toilet seat, also ask the physios to develop a program to strengthen the quads, strengthen the hip flexors, so that in few months, weeks time or months time, that raised toilet seat can be removed, taken away, so that patients can regain their strength. So in my personal opinion, I very rarely issue raised toilet seat or Mowbray. I prefer the freestanding toilet frame because it helps to strengthen the arms, and at the same time, it still keeps the quads and the hip flexors active, the glutes and all that muscles, and doesn't cause constipation. So in some cases, you will have to issue raised toilet seat, but please do not issue raised toilet seat or raise the toilet without thinking the long-term implications. Thanks for watching my video. If you like it, ask me any questions and share it with your friends. But if you are an OT student, I've got a lot of followers who are OT students. Please show your friends in your class about this, because they must know about this. Otherwise, unknowingly, they might be raising the toilet quite a lot and creating a false risk for a large number of patients. Thank you for watching my video. I wish you all the best.